Hello everyone. Today our topic of discussion is aneurysm. Aneurysm stands out to be a disease of vessels. How do we define it and what are the pathologies associated with it is our point of concern here, and what is the pathology behind it. Aneurysm stands out to be a disease of vessels in which there is a bulging of the vessel wall due to vessel wall stress and also development of a weak spot on the vessel wall, which leads into bulging. Let us look first into its definition. It is a localized abnormal dilatation of blood vessels or heart due to plus vessel wall stress. Also, there is a development of weak spot on the blood vessel, and there is a bulging like a bubble or a balloon. It may be of a congenital origin or required. It is also an itis indication for thrombosis and embolization, which in turn there is development of aneurysm may increase the risk of rupture and uncontrolled bleeding, which leads to the complication of aneurysm. This complication may also rise due to myocardial infarction. So the standing reason basically stands as two parts. There is an unwanted or an excessive stress on the vessel wall and development of a weak spot in the vessel wall. Defining it through some simple steps, that is increase in the vessel wall stress and also super added weakening of the vessel wall at a particular point. It leads into development of an outpouch, and it leads into an abnormal dilatation of the vessel wall that leads to the clinical manifestation known as aneurysm. As you can see in this diagram, there is an outbulging, there is a continuum of the vessel wall, and at a particular point, a bulging point which is marked by a blue arrow. Now let us come to the classification. We have in turn classified aneurysm in many types based on different features. And the very first feature is the involvement of the extent of vessel wall. If all the three layers, as we do, the vessel wall comprises of three layers, that is intima, media, and adventitia. If all the three layers of the vessel wall is involved, that leads into development of true aneurysm, whereas if only one or two layer of the vessel, that is the media or adventitia or both of them are involved, it is known as false aneurysm. So true aneurysm will have all the three layers involved, whereas false aneurysm will only have one or two layers involved. Also, depending on the composition of wall, as we can see in this case, how true aneurysm uh, can be bulging on the both the side or either one side wherever the weak spot has developed, true aneurysm develops. Whereas for false or pseudo aneurysm development, you don't need all the three layers. Either one layer or two layer may be involved. Also, based on the classification of aneurysm as true and false, Let us look into the false aneurysm or how does it leads or what happens. As the pressurized blood developing anemia and hypervolemia enters through the defect. So there is a defect in the wall of the vessel and that leads into slipping of blood through the defect wall into the connective tissue. It may cause the separation of intima and layer of media, lead then the development of false lumen that is known as pseudoaneurysm. And this development of pseudoaneurysm, that is separation of the two layers of vessel wall, leads into extravascular hematoma, which is pulsatile in nature because it will react according to the pulse pressure present in the vessel. And this may in turn lead to the rupture of aneurysm, which increases the morbidity and mortality of the person. The second way of classification is based on the shape. As you can see, there are five different shapes mentioned here. First one is secular, having large spherical outpouching. The second is fusiform, which shows slow spindle-shaped dilatation, which is on both side. The third is cylindrical, with a continuous parallel dilatation. Third is serpentine or varicose, which has tortuous dilatation of vessel. And serpentine is quite inevitable. You can see multiple bulging spots. And third is cricoid or the race moss, having mass of intercommunicating small arteries and vein. Let us first look into the secular aneurysm. There is a discrete outpouching of the blood vessel ranging in a diameter for around 5 to 20 centimeters, and it often contains a thrombus. That is the fusiform circumferential dilatation of blood vessel. That is, the whole diameter of the vessel will dilate. Its dimension can be somewhere between 5 to 20 centimeters. In cases it's very large. Also, it involves usually the main site of involvement is aortic arch, abdominal aorta, and iliac arteries. Also, for the uh, serpentine aneurysm, as it can be seen, a left carotid arteriogram showing irregular channels of giant cell giant serpentine aneurysm, and the cricoid aneurysm in the right occipital uh, post-auricular region in 19-year-old male patient is shown to you. Now, it is just based on the shape of the aneurysm that we have the classification. Also, we have the classification based on the location. It is if it's arterial or venous, out of which the arteries are more affected because of the high hydrodynamic stress due to the fast flowing blood into the vessel. It can also be of the capillaries, especially capillary aneurysm is caused, and the heart also. So the location which includes coronary artery aneurysm, ventricular aneurysm, aneurysm of sinus of Valsalva, and aneurysm following cardiac surgery are usually the type of aneurysm found. So the one classification is based on the shape also, not shape, the location of the aneurysm. Next is the aorta, it's known as aortic aneurysm. It can be thoracic aorta or the abdominal aorta. It can also be aneurysm can also occur in the brain, that is cerebral aneurysm, Berry's aneurysm, and Charcot-Bouchard aneurysm. These are the just names of aneurysm found in different parts. It can occur in leg, that is, including the popliteal artery, the kidney, including renal artery aneurysm, and interparenchymal aneurysm. The next or the fourth type of classification is depending on the pathogenetic mechanism. What was the reason behind the development of aneurysm? Like atherosclerotic aneurysm, it stands out to be the most common. Syphilitic aneurysm, dissecting hematoma or the dissecting aneurysm, mycotic aneurysm, Berry's aneurysm. And how do we define them? The atherosclerotic aneurysm, we can understand that atherosclerosis was the basic mechanism involved. Syphilitic, it's a tertiary stage of syphilis, may manifest itself as aneurysm. Dissecting aneurysm, in which the blood enters the separated or the dissected wall of the vessel. And if you want to understand this, let's go back into this diagram where it was shown that the development of a false aneurysm occurs when there is a weak spot in the vessel wall and the blood rushes through that weak wall, separating the intima layer from the media. Then there is a false cavity which has been created. So this one is the dissecting aneurysm, which would be of a pulsating nature. Mycotic aneurysm resulting from weakening of the arterial wall by microbial infection, and Berry's aneurysm, in which small dilatation, especially affecting the circle of Willis, the base of the brain, may be involved. Now let us consider the pathology. Atherosclerosis stands out to be the most common reason for development of aneurysm, and atherosclerosis, especially in aortic aneurysm, is seen. Hypertension, especially in ascending aortic aneurysm, trauma, vasculitis. There may also be associated congenital defects like fibromuscular dysplasia, Berry's aneurysm, typically in the circle of Willis as a result of a congenital defect. Also, infections like syphilis and mycotic aneurysm, so that would lead into embolization of septic embolus as an extension of an adjacent suppurative process by circulating organism directly infecting the arterial wall. Also occurs when structure or function of the connective tissue within the vascular wall is compromised. So what is happening here is we need to understand that the vessel wall structure or the connective tissue in maintaining the integrity of vessel wall, somewhere it gets compromised. So there is some defect in the normal structure and functioning of the vessel. Also, there is a poor intrinsic quality of vascular wall which creates an imbalance in the vascular wall collagen degradation and synthesis caused by inflammation associated proteases. That is, even vasculitis stands out to be the reason for development of aneurysm. So, what is happening that the connective tissue of the vessel wall, although it do have a tendency to degrade, it gets replaced by the fresh lot of the connective tissue. But if there is some imbalance between them, that is the degradation rate stands out to be higher as compared to that of the synthesis, then we will have such type of defect. Also, there may be weakening of the vessel wall due to smooth muscle cell loss and synthesis of non-collagenous, non-elastic extracellular matrix. So these are some of the reasons why the function or the structure of the vessel wall gets altered, and which eventually leads to development of aneurysm. Now let us have a description of the poor intrinsic quality of the vessel wall and why is it so. Whereas defective synthesis of fibrillin leads to aberrant TGF-beta activity and weakening of elastic tissue of aorta. This may result in progressive dilatation in Marfan syndrome. Again, mutation in TGF-beta receptor lead to defective synthesis of elastin and collagen 1 first and second in Loeys-Dietz syndrome. Weak vessel wall due to defective third collagen synthesis are also hallmark of vascular wall in Ehlers-Danlos syndrome and altered collagen cross-linking associated with vitamin C deficiency scurvy. So overall, if you see, so these all are Marfan syndrome, Loeys-Dietz syndrome, Ehlers-Danlos syndrome. These all are defects which are produced in the connective tissue. Uh, Although the first three ones, that is Marfan, Loeys-Dietz, and Ehlers-Danlos syndrome, these all are genetically modified or genetic diseases. Whereas deficiency disease of vitamin C is a replaceable or it can be replaced by sufficient amount of consumption of vitamin C. Also, as I said, there is an imbalance in the vascular wall collagen degradation and synthesis. So, matrix metalloprotease expression increases, especially by macrophages and atherosclerotic plaque, or in vasculitis, degrades virtually all components of extracellular matrix in the atrial wall, hence collagen, elastin, proteoglycans, laminin, fibronectin. Decreased expression of tissue inhibitors of metalloproteases and may be associated with MMP and FIM polymorphism. So, into the MMP, there is matrix metaproteases and TENS, that is tissue inhibitors of metalloproteases. So, there is some change in this concentration. There is the synthesis, either the synthesis is becoming less or the degradation level of the connective tissue increases. Also, we said that there is a weakening of the vascular wall. So, if there is ischemia, there is a lack of oxygen supply to the inner media occurs when there is atherosclerosis. Systemic hypertension causes significant narrowing of arterioles of the vasa vasorum. Medial ischemia may lead to degenerative changes of the aorta and smooth muscle cell loss, change in the synthetic phenotype, leading to scarring, inadequate extracellular matrix synthesis, and production of increasing amount of amorphous ground substance, glycosaminoglycan. So, in all, ischemia, systemic hypertension may also lead to weakening of the vascular. So, the general pathology, how it looks like, due to the etiological reason like atherosclerosis, trauma, or infection, it may contribute to the weakening and degradation of the vessel wall, which in turn, due to hypertensive injury or the stress created by the fast flowing blood or the excess hypertension present, their degeneration and accelerate the expansion of aneurysm. As the aneurysm expands, the wall tension increases, further weakening that this increased wall tension will further weaken the vessel wall, and if it progresses, it will rupture in the near future. We'll continue with various types in the second part.